Hi, I'm Colin. Welcome to Learn Somatics. In this video, I'm going to show you a sequence of somatic movements to help address SI joint pain and discomfort. So that's the sacroiliac joint. So let's get into it. So to begin, we're going to start knees bent, feet flat, like so, on our back. We're going to begin with a little bit of arch and flatten. This is generally how we start most of our sequences. Good movement just to release some tension in the lower back. Inhaling to arch, rolling the pelvis towards the heels, pressing the tail down, increasing the arch of the lower back. We're making a deliberate contraction of our lower back and then slowly letting that relax back to rest. You'll feel your back sink down to the floor. And repeat, inhaling to arch, feeling the tension in the lower back, and then exhaling as you flatten to rest. And as you're doing this movement, inhaling to arch, just notice if you feel like you're going straight down the middle, or does it feel like you're going a little off to one side. Inhaling on the arch, feeling the contraction, pressing the tail down, exhaling on the flatten. Pressing the back down into the floor a little bit. If you do feel like you're going off to one side, that indicates a slight twist. All right, last time, inhaling to arch, and exhaling as we let the back come down, like so. Okay, so next thing we want to do is start moving the pelvis, essentially. So take your two fingers again and place them on the bony part of the front of your hip. And we're going to do just 3 repetitions of each of these. Draw the bony part of the front of your left hip towards your chin. That's your direction. So you're going to draw it up like so. It's not going to be a massive movement, and I want you to keep your back pretty much flat as you do this. And then slowly relax to rest. So we're just doing this sort of small movement of drawing the left side of the pelvis toward the chin. Back is basically flat. And then we're slowly releasing. So we're moving one side of the pelvis. And just notice on this last one, as you draw the left side of your hip to your chin, the right side tends to move away. And then slowly relax. Now let's just repeat that on the second side. So now I'm drawing the right side of my pelvis, this bony part in the front, toward my chin. Right side moves toward the chin. Just notice if it's different on this side. Easier or more difficult. And then slowly release. Pandiculating the muscles that draw the hip up. And again, this is going to help to make that SI joint feel more relaxed and more comfortable. And then slowly release. And then last time, right hip to chin. Right side bony. Right side of the front of the hip to chin. Feel what contracts in your right side waist. And then slowly relax to rest. Okay. Now we're going to alternate back and forth between those two movements. So again, keeping the back basically flat, we're just going to draw the left side hip to the chin, and then the right side of the hip to the chin, and we're going to go back and forth. And see how free and easy you can make that feel. And we'll do that about 4 times back and forth. If you want to do more, you can hit pause and do this for as long as you want, and then come back. We're going to call it about there, just going back and forth, hips up and down. Okay, now, so we've been moving the hips up and down with the back basically flat. We're going to change that slightly. Roll into a little bit of an arch. So just put a bit of an arch in your back. So now your tail is pressing down and there's a little space under your back. And hold this position now as you hike the hip up and down. And this is going to feel a little different. You're going to feel this more up through the back of your spine. Again, just do this 4 or 5 times back and forth, keeping the arch the whole time, getting a sense if you can make that feel about equal left and right. And then slowly relax back to rest. Okay. So we've been moving the hips up and down. Now we're going to change direction. So again, you can keep your fingers on the front of your hips, it's helpful. We're going to go, instead of going up and down, we're going to go forward and back. So because we're lying on the ground, forward is toward the ceiling, back is toward the floor. So begin with the left side again, and just Raise your front of your left hip toward the ceiling. Nice and easy. And you'll feel it makes your right side of your hip press down into the floor. Just hold that for a second and then slowly let the pelvis come back to level. And we're going to repeat that just 2 more times. Left side of the hip lifts up. And then slowly let the whole thing come down. This is the forward back action of the pelvis. Again, left side of the pelvis up in the air. Feel how the right side goes down. And then slowly relax back to rest. Of course, we're going to do the same thing on the right hand side now. We're going to lift the right side of the pelvis up toward the ceiling. The left side goes down. And then slowly relax. And repeat. Right side goes up, left side presses down. Not a massive movement, we're just beginning to re-establish control of moving the pelvis. Moving each side of the SI joint. Right side up, left side down, and then slowly release. Okay. And now we're going to alternate again, lifting the left side, lifting the right side. As you do this, you'll just notice you're just rolling back and forth across the back of your pelvis. The more you roll, the more one side goes down and the other side goes up. Keep your knees pointing basically straight up as you do this. And just see how easy you can make this feel. We're just softening out all the muscles that move the pelvis. In doing so, we're going to reduce the tension around the SI joint. Back and forth. Back is nice and relaxed. Just rolling left and right. Okay, and come to rest. Now, just like we did on the other movement, we're going to introduce a little bit of an arch to this back and forth. So again, roll, arch a little bit, tail presses down. There's a bit of space now between my low back and the table. And we're going to keep the arch as we roll the pelvis side to side. It's going to feel a little different. Again, you're going to feel this a little more into your back. So you're getting a little bit of rotation, but a little bit of extension. And you might find you can do a little bit less movement here, or possibly a little bit more, it just depends. Just notice how it's a bit different when you do it with an arch. Just do a couple of passes of that. And then when you're ready, start to let your back come down a little bit, but keep rolling the pelvis. So the arch is coming out of the lower back, sort of incrementally as we roll the pelvis left and right until we're back at that position where the back is flat. And now that the back is flat, just continue rolling the pelvis left and right a little bit. A couple more times. Alrighty. And pause or rest. Okay, so we've addressed the up-down motion of the pelvis and the forward-back motion of the pelvis in supine. So for the next part of this, we're going to be laying on our front. So let's change position now. Alright, so you're going to lay out on your front like so, head turned to one side. It doesn't really matter which side, just go for the side that's most comfortable for you. You let your head rest down, and you want to have your legs about hip width apart, so just like they'd be right under you when you're standing. And in this position now, we're going to do the same thing with our pelvis that we were doing on our back. We're going to be drawing our pelvis upwards towards the back of our neck, basically, the back of our skull. So let's start on this right side. I'm going to draw my pelvis towards the base of my skull, like so. And you'll see it'll pull your leg up and it'll send your other leg away a little bit, but keep the legs relaxed as you do this. And then slowly come back to rest. And let's repeat that 2 more times. So I'm drawing the pelvis, the back of my hip here, towards the base of my skull. And you might find it makes your back arch ever so slightly, that's fine. And then slowly release. And we'll just do that 1 more time. Drawing the back of the right pelvis towards the base of the skull. And then slowly relax. Okay, now 3 times on the left. Drawing the back of the left pelvis towards the base of the skull. And then slowly release. Again, the legs are relaxed. It's just the movement of the hips going up and down. And as you draw the left hip towards the back of your skull, you can feel how the right hip will move away a little, and then slowly release. You're going to feel this all up through your waist and your spine. Last time, left side hip goes up towards the base of the skull, and slowly release. Okay, and of course again we're going to alternate back and forth now between those two positions. So draw the right side up and slowly release, and then draw the left side up and then slowly release. And it's just a nice easy back and forth of your pelvis, or should I say up and down. And take your time and see how smooth you can make that action feel. And be very clear on what's happening. The muscles in the back of your body and your waist a little that are drawing the hips up and down. And what we're doing here is we're moving each side of the SI joint. We're moving each of the ilia, the outer parts of the pelvis, up and down. We're re-establishing our ability to move the pelvis. Okay, and call it a day there. Now, you can stay in this position, but we're going to put our hands in the front of our hips now, the bony part of those hips again. So we were going up and down. Now we're going to go forward and back, which is going to be, in this orientation, forward and back is down into the table and up toward the ceiling. So again, bring your attention to the front of your right pelvis, the bony part, and we're going to press that into the table or into the floor, and then slowly release. And repeat, press the right side of the hip into the floor, and you'll feel how the left side of your hip kind of lifts out of your hand a little bit. There's that tipping of the pelvis again, and then slowly release. And do that one more time, pressing the right side of the pelvis down, feeling the left side lift a little, and then relax. And now we're going to do this on the second side. I'm going to press the left side of the pelvis down. We're going to immediately feel how the right side lifts up just a little bit, and then slowly release. And we repeat this 2 more times also. Left side hip presses down, right side lifts up, slowly relax. And 1 more time, left side presses down, right side lifts up. These are small movements, but you'll feel a lot of muscular action when you do them. There's a lot to sense. Okay, now let's alternate between the 2 sides. Press the left side down, press the right side down, left side down, right side down. And once you've got a feel for it, you can bring your hands back up if you want and just press into the floor. And that might actually be a little easier. Go back and forth like that, pressing one side down and then the other. Just feel how again it's that same forward and back action of the pelvis. This is going to really help to improve the comfort of your SI joint. We'll do 1 more left and right, or right and left, and then very slowly come to rest. Okay, so we've addressed the up and down and forward back action of the pelvis in the 2 different positions. Let's come onto our back and see what we've got. So once you're out on your back again, just take a moment to pause and check in and see how that feels through the back of the pelvis. You should be feeling quite a bit different in how you make contact with the table or the floor now. And we're not done yet. Bend the legs again, but let them be wider apart this time, about hip width, about the width of your yoga mat, something like that apart. And from here, again, you can place your fingers on the front of your hips so you can feel what's happening. We're just going to let our knee tip in toward our other foot, and we're going to feel how the pelvis rolls up again, but it also kind of lengthens down the side. So we're kind of getting both, so we're kind of getting a combination of the 2 movements we've been doing with the pelvis. And then slowly bring your pelvis back to the table to bring your knee back up. And then repeat on the other side. We use the turning over of the hips and the lengthening down one side to tip the knee in, and then we just roll the pelvis back to the table to and repeat. Left knee tips in, right knee tips in. It's all about what's happening in our trunk and pelvis. It's the turning over of our hips and the rolling across the back of the pelvis that helps us to tip the knee in. This is going to integrate the changes we've made with the previous movements. We did those kind of nice basic up, downs, forwards and backs. Now we're doing something a bit more complex with some rotation. This is good for the brain to learn how to integrate so that when we get up and walk around, it's going to feel easier. I'm noticing keeping my head basically central in the middle. This is a walking exercise, and when we walk, we generally look in the direction we're traveling. Back and forth. Nice and slow. The goal isn't to get your knee down to the floor. The goal is to feel the turnover of your trunk and the relationship between your hips and legs and your back. Alrighty, that should about do it. Come back to the middle. And just before we close it out, let's just revisit briefly our arch and flatten and see if it feels different now that we've freed up the SI joints. When you're ready, you're going to roll into your arch and then slowly release and flatten, rolling the pelvis back towards yourself, towards your chest. And just do a couple of repetitions of that. See if that doesn't feel like you're going a bit more down the middle and a bit more straight down your sacrum. Nice and easy and lazy to finish out. Okay, and yeah, flat. Take a moment, a rest, take a few breaths, and pay attention to the feeling through the lower back, backs of the hips, the SI joint, how all that rests on the table and how that feels down even through into your legs. So that's a sequence to help your SI joints feel more comfortable. Hope you found that helpful. If you did, don't forget to like, comment and subscribe. Thanks for watching, and I'll see you next time.